Hi, welcome to Health Workforce Australia's third quarter report for 2012. Today I'd like to update you on key pieces of work that we are undertaking. Health Workforce Australia's 2012-13 work plan was approved by Australia's health ministers in August this year. The work plan outlines the directions that we will follow as we work with you to build a sustainable health workforce for Australia. Our work plan is underpinned by three core objectives. Firstly, to build capacity to deliver health professionals more efficiently. Secondly, to boost productivity to maximise the use of our health professionals. And thirdly, to ensure the distribution of health professionals to geographical areas and specialties in need. To deliver on these objectives, HWA works in three ways: building evidence through planning, research and evaluation, providing leadership through policy and program development, and thirdly, working in collaboration with governments, health and the higher education sector to deliver health workforce reform on a national and sustainable basis. If you'd like more details about our work plan, you can download it from our website. Earlier this year, Health Workforce Australia produced Health Workforce 2025 Doctors, Nurses and Midwives. This study was the first comprehensive study of workforce requirements for doctors, nurses and midwives between now and 2025. Health Workforce Australia is now ready to follow this up with a new report. Health Workforce 2025 Volume 3 deals with the requirements for medical specialties out to 2025. This report will enable us to plan training, workforce reform, geographical distribution and international recruitment efforts for our medical specialties. Health Workforce Australia's reports identify the need to have health professionals working right up to their level of training. We must boost productivity and flexibility in the way that health professionals deliver their services. This enables patients to access care in a timely and local manner. It also boosts the productivity of our health workforce, assists with retention, and makes sure that we get the best out of our health professionals. One example of this is the Health Professionals Prescribing Pathway, or HPPP. The HPPP describes the steps that health professionals, other than doctors, need to take so that they can safely prescribe medicines to meet the needs of their patients. One example of this is when you visit an optometrist, especially one who is trained and equipped to be able to prescribe medicines for an eye condition. Under previous arrangements, the optometrist would be able to undertake an assessment of the eye condition, and then it would require a separate visit to a general practitioner or another physician to prescribe the necessary medicines for that condition. Under the HPPP, these steps will be simplified. The patient will be able to receive their treatment in a timely and safe manner, and the health professionals will be able to practice up to their level of training. Of utmost importance throughout this project is the need to ensure that practice is safe, the health professionals are regulated, and there is good communication between all those involved in providing care to this patient. We're now designing the draft Health Professionals Prescribing Pathway. Keep an eye out on our website for future developments. Another example of boosting productivity is our new program on expanding the scope of practice for nurses, physiotherapists and paramedics. By expanding the scope of practice or the range of activities that these health professionals can undertake, we are able to improve access to care, boost the productivity of the workforce, assist with retention, and ensure that all of our health professionals are able to work up to their level of training. Health Workforce Australia has committed over $11 million to 29 projects nationally, like the Extended Care Paramedic. This will enable us to trial this model across a range of settings and a number of different professions. Our first event focusing on Australia's future health leaders was a great success. Over 300 students and early career professionals gathered in Adelaide recently to discuss and confront the challenges facing Australia's healthcare system. This group of future leaders were able to identify policy options and consider innovations and solutions to Australia's health workforce challenges. We are now looking to progress the ideas and outcomes that came from this forum, and we look forward to supporting future health leaders. We are proud to present our inaugural Health Workforce Conference, Inspire 2012, Reshaping Australia's Health Workforce. We're excited about bringing together a distinguished group of speakers and presenters from Australia and around the world to consider the future of our health workforce. Films, presentations and papers from this event will be available on our website. In closing, thank you for your time today. You can follow our progress through our monthly newsletter, our website, Twitter or by Facebook. And we look forward to talking with you again.